why am I having all this trouble with my hormones? Hi, I'm Dr. Katie Thompson with the Health Improvement Center. I want to discuss today about female hormones. A lot of the clients that come to see me are women who have either menstrual cramps, PMS, premenstrual syndrome, or get irritable just before their period, or are they on the other side of the spectrum and they're having problems balancing their hormones. They're having hot flashes or night sweats, they're irritable, they can't sleep. When I was 13, my mom and I went to her GYN, her OBGYN, and he put me on birth control pill. I was on the birth control from age 13 to age 30 because I was getting such severe menstrual cramps and such tremendous amount of bleeding that I would pass out. First things, you gotta get rid of the sugar. Sugar, the three things that will cause and aggravate hot flashes and night sweats: sugar, stress, and alcohol. By sugar, I mean candies, cakes, cookies, ice cream, soda pop. You need to get that down and out because you'll find when you have less of that, one, you'll have a great side effect of losing weight. Two, you'll start to feel better and your hormones won't be so crazy. Imagine this is your cell. You have receptor sites. Let me pull off a few of these. You have receptor sites on the cell for hormones. So let's say you're taking bioidentical hormones or hormone replacement therapy. So what it does is those receptor sites are specific for female hormones, let's say specifically for estrogen. When you're taking an exogenous hormone, what you're telling the body is, okay, those spots are full, we don't need to produce the hormones. So now you have a lot of free-floating hormones going around, and those will get stored in your fat. If you eat more organic, like eggs, raw milk, chickens, or meat, you want to get them organic, because if they're not organic, what happens is if those animals were pumped up with hormones, you're not getting those in your body. And those can do the same thing, replace those receptor sites, and you're like, why am I having all this trouble with my hormones? If you just clean up your diet, a lot of that will lessen. So, homework. One, get on organic as much as you can. I would start with the eggs and the chicken and the beef. When you're dealing with hormone issues, it can be one of a few organs. It could be the pituitary, the thyroid, the adrenals, or the ovaries. And this is called the endocrine triangle. And now an endocrine gland is any gland in the body that secretes a hormone. We want to make sure that these are in balance. The purpose of this endocrine triangle is if one area is stressed, let's say the adrenals are stressed, the adrenals are your fight or flight organ. So if the adrenal glands are stressed, then you're going to have more symptoms of hormonal imbalance. So when a woman goes through menopause, what happens is ovaries shut down, they stop producing hormones, but the adrenal glands take over. My mom, who passed away, she never had a symptom of going through menopause. She was completely normal. When she went to her doctor's like, oh, you're going through menopause, let's put you on HRT. And she's like, why? I don't have any hormone issues. Why do I need to go on HRT? So she never did. And she never had a symptom, never had a hot flash, never had a night sweat. That's normal. That's what it should be like. If you're having any of those issues, reach out to me, make a comment on the video, or reach out to the clinic. It's again the Health Improvement Center, and I'd be happy to see what I can do to help you.